Hello, everyone. My name is Dina Badawi, and I'm the Mental Health Program Coordinator at OCASI. We're very happy to have you here this afternoon for the second webinar in our series. And today, the webinar will be facilitated and hosted by the Hong Fook Mental Health Association. And we have Emily and Maria here that will take you through the webinar.
Hello, everyone. Good afternoon. It is a great pleasure that today I and my partner, Emily, can be here to share another important topic with all of you, mental health and stigma. Okay. That is some technical, please bear with me. There's from time to time, there is a technical issue. So today we are going to dispel the myth on mental illness. I'm sure I still remember when we start our journey, when we go and talk about mental health, people will think about, when they hear the term mental, automatically people will think about mental illness. So let's dispel the myth on mental illness and increase some basic knowledge of common types of mental illness, and also increase the knowledge and skills in early identification related to mental health issues. So first of all, let us look at demystifying the mental illness. I will pass the time to Emily.
Thank you, Maria. I wanted to give you a definitions first. It's always helpful to have definitions too that we can refer back to. In 2001, World Health Organizations also state that mental health is a state of well-being. The state of well-being in which that individual is realizing that his or her own ability and can cope with normal stress in life and can work productively and fruitfully and able to contribute to his or her own community. So that is actually quite positive.
You're on mute.
You're mute. Okay, maybe I will take on this one. So when we talk about why are we talking about mental health? It's a very important issue. As when we look at the statistic, we realize every 5 people, there is one person experiencing a mental health or addiction problems. So when we are talking about this, when we are looking at this statistic, we have to be also bear in our mind that not everyone who has mental health issue will come out and talk about it or to even seek help. As we all are aware that because of the stigma, people are very reluctant to talk about it and even to come and seek out. So these statistics only reflect part of the truth. So if that, maybe is much higher than 1 in 5. And also, those people who are coming out to seek help, who identify themselves, have the mental health issue, they have family, and they have co-worker, and they have friends. So it will also affect them. So eventually it affects everyone. So that is why it is very important that we are more aware of it, and we will know how to cope with it.
Sorry, I don't know why that's happened there with the mute.
That's okay. Yeah. So like when we look at more the statistic, in any given year, as we can see, every 5 people, there is one person affected by mental health issue, and also is causing the government more than 51 billion annually. So that is a tremendous amount of money that, and also from the statistic is showing that is on the rise as well. So no country can sustain that kind of expense. That is why we recognize and realize prevention is always better than treatment. If we can prevent it from happening or prevent it from escalating, it is very cost effective. And I would also like to share with you one more statistic. In Canada, what they found is that mood and anxiety disorder are among the most common types of mental health issue in Canada. And it, as we all aware and appreciate that it really impact on individual's life, the whole aspect. Emily.
Yeah, so let's just talk about myth and facts now. So I'm going to do some pollings as well. So if you can we'll do yes for true and no for false, okay? So the first statement, Maria, you have to move the slide because I can't. Oh, perfect. All right. So if you don't have mental illness, I'm not affected by it. So can you please let me know what your take on this? Yes is for true and no is for false. A few more seconds. Okay. I can share the results. So basically, 15% of you would say that yes, if I don't have mental illness, I'm not affected by it. But the rest of you, 85% said no. So I wish I can hear some of the reasons from you. But it is a false. So if I don't have mental illness, I'm not affected by it. Like many of you know that, I mean, we don't live in this community by ourselves. So Maria mentioned earlier, is 1 in 5 Canadians affected by mental illness. So if we were to, we have 130, 25 people in the room right now, just stats, then every 5 of us, there's one that affects by it. And we work with them. There, some of us are our friends, our family members, our neighbors. So even though we don't have mental illness, but it still affects us as an individuals. We live in the community and we work in the community. So all Canadians been affected by mental health issues or mental illness. Statement 2, mental health factors such as stress, anxiety, and depressions don't affect your overall health as much as physical factors. So again, yes is for true and no for false. So let's hear from you folks. A few more seconds. Just half of you voting. Yeah, just a few more seconds. Yeah. All right. Perfect. And I will stop when we hit 100. How about that? There's 125 of you, and some of you still undeciding. Okay, so let's stop the voting. Okay, so I will share the result. Again, it's about 20% of you say yes, mean it's true, and 80% said no, means false. So it is false because I don't, if you remember from last time that I share holistic health. So basically everything that your mind is, your state of mind is actually connect to all, it shapes all physical state as well. So both of them are the same. If you're not completely healthy, if you're not, you cannot balance. So extra stress or increase of stress release such a hormones that it can affect your, locus, your sugar level. It can accelerate diabetes if your bodies cannot digest it too fast, or high anxiety can lead to high blood pressure. So this is false because everything is interconnected, right? So, okay, we can go to statement 3. People with bipolar are moody. What do you think? Yes. If someone can mute their microphone on that side, will be good. Okay, so again, yes is for a true, and no is for false. So people with bipolar disorder are moody. Awesome, you guys are good. Okay, I'll stop when about maybe 100 have reached. Almost. Awesome. Okay, a few more votes. All right. Okay, the rest of you are unsure, that's fine. Okay, so we have here is almost 50-50. So 47 say yes, which is true, and 53% said no, which is false. Okay, so it is false because bipolar, it is a mood disorders, but when an individuals have their high means mania state, mean they're very high energy, they cannot sleep, they doing many things like a super men or super women or super human beings. And when they're in the low stage, they will be very sad, very depressed, and manifest to suicidal thoughts. And then it would very hard for them to concentrate. So basically, yes, it is a mood disorder, but they're not moody. They're not like swing one minute they're happy, the other minute they're sad. They're gradually, or take like a week or two before the mood have changed. Okay, so that is that. And the one more things before we move on. Different people, different race are more prone to mental illness. So if you belong to certain populations, you're more prone to mental illness or mental health issues. So let's say yes is true, no is false. Almost. Wow, you guys are super fast. Thank you so much. Thank you for giving such a undivided attention. The number is actually quite fast this time. Okay, so I wanted to share this and so this one, 32% say yes, which is true, and 68% said no, which is false. So I wanted to share with you that genetically we're 99% are the same. But if you remember, we talk about social determinants of health is that some populations or some demographics might not able to access to health or to the care or to the informations as much as others. So, and also different cultural belief or influences might interpret the symptoms differently. So it's false. Everybody are genetically, we're the same. We're prone to the same in terms of the same rates in terms of mental illness. Okay, so that was fun. Thank you so much for participating. I wanted to show you this graph. It's actually, it's simple, but you can see that impact on mental illness reflects on all aspects of our lives. It's emotional, cognitive, social, and relationships. It's major, and that's also linked to our employment, spiritual and physical. So all aspect of ourself are been affected if we have mental illness. So before we move on to anything, I want you to remember this. There's mental health does not equal to mental illness. Okay, so there's three states. Mental health, everybody should have mental health. Mental health issues, everybody have mental health issues. If you telling me, Emily, I don't have any mental health issues, I mean, you're not being 100% completely honest to yourself. And if you don't take care of that mental health issues, it's manifest to, and your body will lean toward, prone toward mental illness. So three different things, okay? Mental health issues, and mental illness, okay? I wanna show you another graph. This is something that it affects everyone, not immigrants, not non-Canadians or refugees. This is everyone. So at Hong Fook, we very focus on holistic health. What you can see in the middle, it's physical, spirituals, and mental health. That is your own personal circle there. And there's 4 factors that affects your mental health, affects everyone's mental health. The first one I wanted to talk about is predisposing factors. It's something that it's already have been given to you, like biological. You cannot choose, or you cannot choose to be, you have good genes, or who your parents would be falling in love with and have you, you was born a woman in a, in the environment that maybe I wanted to be born in of course in the royal family, but no, I was born in the middle of the war in Vietnam, and I'm a woman, right? So it's already giving to you. There's no other controls over that. And the second P I wanted to talk about is precipitating factors. So this is something that it might not be in your control either, and it's affect greatly in your mental health, is that the loss, a loss of someone that you love, a loss that maybe you lose a job, you you lost something that you could not never find, that is very valuable to you. Migrations, we talked about migrations a little bit last time, is that when you choose to migrate to move to another part of the world, or another part of the city, another part of wherever you are, you migrate. Sometimes it's your choice, or sometimes it's not your choice. It affects your mental health greatly, because you have to find other supports, right? Trauma or war, we cannot be in control. Trauma, it could be something that an accident, a car accident, accident at work, or something that you you witness that you don't want to, right? So that is the precipitating factors that might not be in your control. Then it affects your mental health greatly. The third one is perpetuating factors. So this one is something that has happened to you day in and day out. Maybe, we lost a job, and we looking for a new job, and we're very eager. We're like, you know what? I will look for another job within a month. 1 month passed, you cannot find it. 2 months, 3 months. So day in and day out, it affects on your mental health. It's like, maybe I'm not good enough out there, or maybe nobody wants my skills. My skills is not up to standard. So it affects your mental health status. Not able to yeah, we find a job, but it's not, maybe the income is not there, and then you cannot find a safe housing. You feel exclusions in your community that you live in, or the workplace. You're stressed. So this one is happening day in and day out in our lives, and it's harder for us to deal with. And the fourth one that I like to mention, to share with you, is the protective factors. So this is where you folks come in. It's already, by the name of it, it's quite positive, is that we as professionals, we help people find housing, find job. We support individuals, people in the community. We learn and we share the coping skills, and we make newcomers or refugees, the populations that we serve, feel inclusive, feel that they have a lot of support. So these factors around us, around every one of us, affects greatly in our mental health. So if that sounds okay, yeah. So I also wanted to talk to you about stigma. Okay. So stigma and mental health is normally come hand in hand. So stigma doesn't come just like that. So stigma come where everybody has an attitude. Like we have to sometimes acknowledge our attitude or judgment toward um, one thing. When we talk about mental health, I remember when I started working at Hong Fook, and my mom was asking me, "Are you sure you want to work at Hong Fook? Is it safe?" Right? So it's an attitude, it's a judgment. Mostly, if you can go to the next slide, I think it will be more clear to so that we can maybe understand it a little bit. Is that when we have negative attitude, um, it's like a judgment, and then when you have that judgment, you automatically have that response. So when we have negative attitude, it become negative response, and then you discriminate that uh, uh, toward that issues. So that's equal stigma, right? So if you think that people with living with mental illness are maybe uh, sad all the time, they're not very productive, so just disregard them, and you automatically have this discriminate stigma against this population. So stigma means think less of a person, of the conditions that we may have. um, Maybe if I have a missing limbs, I cannot run as fast as the person who have the full limbs, or go as far as of a distance as the other one that have full limbs. But we can still contribute very meaningful ways, or contribute to the race in a certain ways, right? So stigma means think less of a person because of their either visible conditions, or maybe we think negatively of their invisible conditions. So that is what we kind of pass judgment. So stigma can make a person um, who feel who stigma can make the person feel unwanted, or shameful, or useless. So when we pass certain judgment, it's actually it's both the receive and the ones who give judgment, both negative thinking. Okay, so I wanted to show you a video on reducing stigma. Okay, so let's see this video.
Leading to discrimination. The stigma around mental illness continues to be widespread. Stigma is both powerful and persuasive. It prevents people from acknowledging their own mental health problems and asking for help. It affects people living with mental illness in many ways, limiting career opportunities, damaging friendships, triggering acts of bullying, or even violence against them. Living with stigma can be worse than the mental illness itself. Many feel they have to hide their condition. Mental illness is a medical condition. It's not a choice. Stigma through understanding, suffering from mental illness can recover and continue living successful and productive lives. Break the silence. Talk openly about mental illness and help change attitudes and behaviors.
Okay. Okay, thank you so much, Emily. And I would like to also share the impact of stigma. According to WHO, the World Health Organization, the biggest barrier for stopping people to seek timely intervention, people who's affected by mental health issue, to seek timely intervention, it is stigma. It is not only because of there is lacking of culturally competent services or lacking of psychiatrists, lacking of health practitioner. Of course, that is one of the issue too. But the biggest reason is because of stigma. People does not want to be even seen, to enter our agency to seek help. I still remember when I first joined Hong Kong, we have to do a lot of training for the volunteer, and this bunch of volunteer, they already aware of the services we provide, and we only serve like people who are having mental health issues. So they come and they receive all the training, and at the end we are supposed to assign them for tasks, but many times they are very reluctant. So when I try to find out the reason, like is it that they still not feel ready or confident enough? And what they said is that, you know what, Maria, I know that people who are affected by mental health issue, they are not violent. They are less violent than the so-called the people who does not have the mental health condition. They know all this truth, but yet they still don't feel comfortable because I don't know how to, I'm afraid that maybe the way I act or the way I talk will offend them. So from this sharing, we can really see when we're talking about stigma, it is not only about always negative, not only about, we think that people who has mental health issue, they are violent, they are unpredictable. Not only the negative side, and even they know that that is not the truth, and they know that they are less likely to be aggressive or to inflict harm, and yet they still don't feel comfortable because they felt that they have to act differently when they are around with them. So that is in a way that it is some sort of discrimination or stigma. So they believe that they need to be treated differently. So that's why when we are talking about stigma, it is very important that for each one of you, I know that our role as a frontline worker may not be, we are not there to diagnose because we have psychiatrists, we have health practitioners to do that job. But if we have client or consumer who's being affected by these, who is living with mental health conditions, we would like to provide that support. So how do we provide that support? And so in order to learn some basic knowledge, and also to learn the factor that is really the most effective way to provide that effective support. And also I would like to share each one of you that today we have great honor. We invite one of a consumer who recover from a mental health condition. He is going to join us later on to share his recovery journey. And we strongly believe that we each are the master of our own issue. So we are the expert. We know what is the most effective way to help someone who are in the similar situation. So before he joined, let's look at the different types of mental illness. Okay. So there is a psychotic disorder, and under that, we will talk about the schizophrenia. And our friend who will join us later on, he's going to talk about that. delusional disorder, and mood disorder. We are going to talk about depression. I'm going to show you a video that talk about that. Affective disorder is also under the mood disorder. And also anxiety disorder. I'm sure that many of us may be supporting people or even our friends who are affected by that, the PTSD, post-traumatic disorder, post-traumatic stress disorder, right? So as we shared earlier with you, that in Canada, the most common mental health condition is mood and anxiety disorder, and it had a major impact on our daily life. And now I would like to show you, I would say it is a very helpful YouTube video that really capture how we can detect some sort of the sign of mental health issues.
Maria, can you make sure the volume is high? Because the last video was low for someone.
Okay, thank you so much. Yeah, I will make sure about that. Okay.
In this video, we will highlight some of the signs and behaviours associated with mental health conditions. Knowing these signs may help you, your friends and family, or work colleagues break through the stigma surrounding mental health and start a discussion. Statistics have shown that 1 in 4 people will suffer with a mental ill health issue in any given year. This can be as high as 1 in 2 adults who are in debt. Over the past 25 years, anxiety and depression in teenagers has risen by 70%. Mental ill health covers a wide spectrum, from the worries and grief that we all experience, to severe depression or complete loss of touch with reality. Anxiety. We all experience levels of stress and anxiety, whether work pressures or family related. However, for some people, the feelings of anxiety can be prolonged and extreme, making it difficult to carry out simple, everyday tasks and can even cause panic attacks. Common signs to look out for when dealing with an anxious person include reduced concentration and memory, difficulty making decisions, become irritable and angry, and avoid certain situations. Depression. As with anxiety, most of us will experience ups and downs in our lives and during difficult times. If the low mood doesn't improve or go away, this can be a sign of depression. Someone suffering from depression can feel sad, anxious, guilty, angry, helpless, and hopeless. They may also have low self-esteem and a tendency to believe that others only see them in a negative light. Other signs to look out for are self-criticism and blame, impaired memory and concentration, neglecting responsibilities, and loss of interest in appearance and personal hygiene. Bipolar disorder. Bipolar disorder is a severe mood disorder and causes unusual fluctuations in a person's mood. People with this condition can find it hard to maintain relationships and jobs due to their extreme moods. They may lack focus or be unwilling to concentrate on what to you seems to be an important issue. People with bipolar disorder can be full of energy and talking very quickly, easily distracted, going off on unrelated tangents, lacking in energy, or feel sad, pessimistic, and hopeless. Schizophrenia. Schizophrenia is a widely misunderstood and feared mental illness. People who suffer from schizophrenia do not have dual personalities, but are rather split from reality and may have delusions about themselves or others. These symptoms can have a major impact on the ability to hold down jobs, maintain relationships, and many other aspects of everyday life. People with schizophrenia may appear distracted by things that to you doesn't seem apparent. For instance, They may start paying attention to another unheard voice, or even have a conversation with someone who isn't present. This can result in them finding it difficult holding a conversation while they are distracted with other thoughts. Obsessive compulsive disorder. Obsessive compulsive disorder, known as OCD, can be a very disabling condition. Feelings of anxiety are combined with obsessive and unwelcome thoughts that lead to compulsive behaviours. A common obsession is a thought that dirt and germs have contaminated them and find themselves needing to wash hands frequently to feel clean. Compulsions are repeated activities that a sufferer feels compelled to carry out, such as constantly checking that a door is locked. These can be challenging for a person when dealing with routine tasks and managing relationships. Other common obsessions that you might notice are repeating actions and becoming anxious if they are unable to do so, fixating on a number, washing and cleaning ritually. If you think you or someone you know has a mental health condition, you are not alone. Wiltshire Mind is a local charity offering 3 main areas of support for mental ill health: You in Mind, peer support groups, counselling, and telephone service. Details can be found at wiltshiremind.co.uk.
Okay. Sorry. Right. So I have to share screen again. So this one. Can you see the screen?
I think you have to stop sharing
Oh,
the screen.
Okay, so this one. Maybe I have to stop this one first. Sorry about that. Okay.
Yeah,
Yeah.
that's
Good.
okay.
All right.
Yeah, that's better now.
Very sorry, because this is the first time we are using the YouTube. We usually convert that into the video current. So I would say that slideshow. Okay. When we talk about major depression, that is one of the most common mental health conditions that people are living with. At Home Folk, we also help lots of consumers who are affected by that condition as well. So when we're looking at the prevalence rate, the major depression, it is a mood disorder, and people who's affected by that feel sad, devastated stage, and that they don't have any energy to do other thing or to concentrate. It's also a difficult thing. And the thing I would like to bring to your attention is that when we're looking at the prevalence rate between male and female, we can see that it affects female 2 times higher than the male. So that's why I always ask the audience, like, do you think that female are more emotional, that they are more easy to be depressed? And that is, of course, many reasons. Maybe because we have so many different roles, and also maybe women, because of the socialization, we tend to talk, when we talk about our emotion, we are more ready to talk about that compared with our counterpart male. That is also maybe one of the reasons. But I would like to bring to your attention that most of these mental health condition or mental health issue, they happen in the younger adults. Like usually the age of onset start at 20 to 40 years old. So that is why when we are talking about mental health, it is very important that we will have that awareness since early stage on to prevent it from escalating. So already we took a look at the symptoms when we show that video. So it change in appetite and weight, the sleep problems, either sleeping too much or too little, loss of interest in work, hobbies, feeling of uselessness and hopeless and excessive guilt, loss of energy, slow thinking. I would like to share with you that I still remember at Hong Fok, we have many consumers who's affected by the depression. And when I first joined Hong Fok, we will always think that, oh, we will try to encourage individuals to come out and to join the other group. But when people in certain, in that condition, sometimes it is very difficult. And also each individual are different. Even we may be affected by the same illness or the same health issues, but maybe we treat it differently, or we will use different approach. And maybe because my family background, I don't have that support, so it is very difficult for me by myself to to move on maybe. So there is many reasons. We cannot use one formula to fit everyone. So let's look at another anxiety disorder. There is one form of anxiety disorder, is the PTSD. I remember that when we go around and doing this, sharing this workshop, actually, in fact, many people share with us, even they have never go through war or something, but there is always something that maybe maybe from their childhood or from some very way back incident that's still impacting on their mind or on their grow up process. So they may not even aware. So when we're talking about PTSD, it really affects a lot of the population. So one of the some of the symptoms we will talk about is the difficulty falling or staying awake. Unwanted thought will come to visit, the flashback, acting and feeling as if the event is happening again. So that extraordinary event keep coming up, flashback at the least expected moment it can come. And you feel extra cautious and extra hyper because you have to deal with that anxiety, that anxious, and feel very distressed when someone remind me of that incident. So again, when we look at the prevalence way, it is an anxiety disorder, and it produced by an extraordinary stressful event. It can be maybe the war, or it can be a car accident, or maybe if I'm being abused since I am young. So that's why when we share with you earlier about the 4P model, that the 4P that affecting each one of us, our mental health, the perpetuating and precipitating. So an event happened that may be beyond our control. But if we are living in that situation for a prolonged time, and that we will need to take longest time to recover from it. Say if it's only stand alone, one single event happen, then maybe it's I have a faster. It take me like a shorter time to recover. But if I have been living in that condition since I am a child, being abused since I'm a child, it would take much longer time to recover. And we talk about that, the experiencing of the UN and the flashback and the nightmare. It affects 2 to 5% of population, but actually a lot of statistics have shown that it should be much higher. And it affects, of course, the red much higher, because of if they have gone through the war, that they have witnessed maybe death, that will also definitely impact. When we look at the male to female, the gender ratio, again, it affects the male, it affects the female 2 times higher than male. And when it comes to the age of onset, it can affect people in any age. So, because that we have no control of when will we encounter the extraordinary event. So now I would like to talk a little bit about, about the treatment approach. There is psychosocial and medical. At Hong Kong, I and Emily, we work a lot with the psychosocial, the group, to help individual and day program, the ACT program, vocational program, psychosocial program, peer support, which is like a very effective support for individual, case management, alternative treatment, other community support. Medical, of course, we are all aware, the psychiatric medication, and seeing a specialist, psychotherapy, a talking therapist, electroconvulsive therapy. So like that is two models. Well, before we go into the case study, it is with great pleasure that today we have one of our a colleague join us to share his first-hand experience. Like he has, when he was in university, when he is still going to the university, he has encountered some mental health condition. And how does he recover from that? And let's learn from him and what has been helping him to recover. So Jason, are you there?
Hi Maria.
Oh, hi, Jason. Thank you so much. It is a great pleasure having you there. I would like to say that Jason does not want to show his face, but he wanted to share his own experience as well. So Jason, can you talk a little bit about your university, that experience, that how you come to know about that mental health conditions?
I started to experiencing symptoms of schizophrenia when I was studying in the university. I remember that when I was in the third year of the university, one time I was studying in the library, and suddenly I hear voices talking to me, but at that time, I don't realize that that was the symptoms of schizophrenia. I thought that was I'm daydreaming, but after that, I have hear more voices and more, and then I start to believe that I can connect with other people with my brainwave frequency, because I don't need to see other people, but I can still connect with others and talk to each other. And somehow I have some hallucination and delusional thoughts.
Yeah.
And I remember that when I was studying in the university, when I was in the lecture, I will hear voices, and then when I hear the voices, I will laugh out very loudly. And the other student and the professor will ask me why I'm laughing, but I cannot tell them what happens to me. But I only say that I'm very happy. I'm so happy to laugh out, and then just don't know what the symptoms of my schizophrenia.
Oh, I see. So at that time, you when you hear these voices talking to you, are you like from your point of view, you feel that someone is really talking to you, right?
Yes. And some of the voices, I realized that they are the actor or the celebrity in the Hong Kong. They may be a singer in the Hong Kong, or a movie actor or a TV star. So I'm so happy to talk with them. So
Right.
I really believe myself have a special power to connect with them.
Oh, wow. Okay. So okay, so that condition lasts for how long?
Oh, I think this condition lasts for almost three years.
Oh,
Because,
3 years.
yeah, because since the starting, I hear the voices.
Mhm.
I didn't realize that I have some symptoms of the mental health issues, so I didn't seek any help. And even for my family members, my parents, they
Right.
don't know what going on with me. They thought that I was having some problem with the spiritually, like the evil spirit. They controlling me or affecting me.
Okay, so okay, so for these 3 years, you just thought that like you are really having a dialogue and meeting with all these famous people, and you're talking to them, like with them, until 3 years later. How do you come to know about what really happened?
I remember that I'm so lucky I can still graduate from the university. But after I graduate in the university, I stay a lot of time inside my parents' home. So I spend a lot of time to talking with the voices. And at one point, I remember one night when I was walking down the stair from the home, my father is shouting at me and saying that you are making too much noises, keep quiet. And because of that, I heard the voices saying that my father is going to kill me. So they asked me to call 911. Then I go to the telephone and call 911 and tell them that my father is going to kill me. But
Right.
when the police come,
Mhm.
the police officer noticed that my father won't do that, and they bring me to the hospital. And
Oh,
I spent one night in the hospital, and after one night, I I think I have to see a psychiatrist, and she asked me that what happens to me last night, and I say that I hear voices saying that my father going to kill me, and then after that, the doctor prescribed me a medication to take.
right.
After that, my parents bring me to the pharmacy and get the medications. And at first they asked me to take the medication, but at that time I really refused to accept myself have any mental health issues, so I refused to take the medications.
Oh,
But
right.
I think this is the first time I have encountered with the hospitalized in the hospital.
Oh, okay. So that is your first time being admitted to the hospital involuntary, right?
Yes,
Right, right. So you were seen by a psychiatrist, I assume, right? And
yeah,
being prescribed the medication.
yes.
Right, right. So did they provide you what happened and give you advice how to seek support?
I don't think so. After that time seeing the psychiatrist, I didn't have any follow-up on my mental health issues. They just give me the medications, and the only thing that I can help me is to take the medication. But at that time, I refused to take it.
Yeah.
So I don't have any help from other like family doctor, psychiatrists, and
Okay.
even my parents, they can't help me because I refuse to take the medication.
Right, right, right. So when your parents are aware that you are having this mental health condition, did they understand or did they try to support you?
I don't think so because they don't have much information and they don't know much about mental health issues. So uh, the only thing they can help me is to ask me to take the medications, and then because on the other hand, I lie to them that I tell them that I don't hear any voices anymore. So they don't think I have any problem with my mental health issues, so they stop bringing me to see the psychiatrist or
Right.
stop asking me to take the medications.
Right, right. So, Jason, you share with us that this condition has lasted for 3 or 4, even more than 3 years. Then, if you are before the onset and that recognizing what is really happening to yourself, and during this time, like when you were given that diagnosis, can you share with us your feeling and how that stigma really impacting on your health seeking?
I think I do have some kind of like self-stigma, because for myself, I really refuse to accept myself as a mental health problem person. I think I'm doing well, and
Yeah.
that's why I don't seek any help from other psychiatrists or family doctors, and not accepting to take the medications.
Right.
And my parents, they don't have much information about the psychiatrists or the mental health, so they can't help me a lot.
Right, right. Oh, yeah. That it must be a very devastating situation. And I remember you also shared with me that when your parents come to know about talk to the doctor, that they don't want to accept that, and they were trying to say that it is your behavioral problem, and also trying to say that you are possessed by an evil spirit, right?
Right.
Yeah. So it take a, then can you talk about what is the turning point? Like, that is really a very devastating situation. And what are the turning point?
And after I graduate from the university, I stayed home for almost 1 year. And
Okay.
then I realized that I'm not doing anything in Toronto. Then I'm trying to go back to Hong Kong to find a job. So I I fly back to Hong Kong and stay Hong Kong for about half a year, and then I relapsed. And I remember one time when I was in a shopping mall, I heard voices talk to me, and they asked me to standing still there and close my eyes and then take off my clothes. Then I do all the things that they asked me to do, and somehow some people call the police, and the police come and they bring me to a hospital. And this is my first time I stay in the psychiatric hospital for about 3 or 4 months. And,
Wow.
and at the time in the hospital, we are mandatory to take medications. So every night I have to take medications, but the medication has so much side effect on me. After the medications, I will feel anxiety. My hand will shaking, my leg will shaking, and I was, even though with the medications, I still hear voices inside the hospital. So I after I discharged from the hospital, I refused to take the medication because of the side effect. And then after a couple of months, then I fly back to Toronto and I go back to my parents' home.
Right, right. Oh,
And
okay.
and when I was living with my parents, I remember one night I was inside the washroom. I was having a shower, and because I have some delusion and hallucination thoughts, I was laughing out so loudly, and my father and mother think I was doing something wrong, and they opened the washroom doors and come into my showers. And at the time, I was so angry, so we have some physical fight. And then my mother called the police, and the police bring me to the hospital in Toronto. I think it's the North York General Hospital. And then I stayed there for about like 2 months, I think that. And then after that 2 months, there is a social worker for Hong Kong. They come to visit me, and she say that, explain to me that my parents is not allowing to me to go back home to live with them. I need to find a place to live. And they say, at that time I was so frustrated because I never think that my parents will reject me and don't let me live with them. And then they arrange a boarding home for me to live in. And after that, I was living in a boarding home.
Oh, wow. Okay. So, all this while, wow, that, from your sharing, thank you so much, Jason, that we can see these conditions affect you in every aspect, not only about your work and also your relationship with your family, with your friends, and it affects you on a daily basis, right, on your living.
Yes.
So can you talk about, I realized that you talk about the medication and you start taking the medication, and does it help you?
Mm, at first, after I was living in the boarding home, I have a psychiatrist to follow up on my mental health issues.
Right.
And at that time, the psychiatrist just give me some injections every 4 weeks. So I only take injections instead of the oral medications.
Right.
In the first year in the body home, I was okay because after the injections, the voices and the delusions, hallucination force is gone. But after 1 year, the voices come back and the delusional force and the hallucination, they all come back.
Okay. Okay. So after 1 year, like that doesn't work anymore, and it come back all the voices, right, and the hallucination.
Yeah,
Right, right.
yeah.
So, can you talk about like we would really like to learn from you, because at our maybe our surrounding, even our friend and our maybe relative and our consumer, our client, if they are in a crisis situation or in these mental health issues, living with this mental health issue, what is your experience? What will be the most helpful, like for us to know, like, because we are not doctor, we cannot prescribe medication, and so what is the most helpful thing that you receive from Hong Folk?
I think I do have a mental health social worker with me when I was in the boarding home.
Right.
And I think my social worker is helping me a lot for my mental health issues because uh, I don't have any friends or I don't have my parents supporting me, and my social worker is the only person who can support me. And even though sometimes I ignore her or don't try to connect with my social worker, but the social workers keep talking or visiting me and don't give up on me. And then after a couple of months like that, I rebuild the trust, and then I start to trust my social worker and listen to her and try to understand that I have mental health issues and I need to take medications.
Oh, all right. Wow. Okay. So, wow, that is great. So, through like this, establishing this strong rapport relationship with your social worker, that you build the trust and you begin to regain the hope, and you start taking the medication again, right?
Yes.
Yeah. How about the psychosocial program? Did you also involve in the group program?
Oh, yes. Because of my social worker introduced me a self-help program in Hong Kong.
Mhm.
Then at first I refused to go there because at that time I was really isolated and disconnected from the reality. I don't think I can have any help from the other people. But after she saying that many times that I need to try to go to the self-help program, that will help me a lot. Then I listened to her, and then at first when I was in the self-help program, I just observe other people interactions. I don't even talk to other people, but after a couple of times I've been there, there is other peers or the workers approach me and they start talking to me. And then because of that, I start to have some relationship with other peers. And then the other thing is, I think the peers does help me a lot because I feel a sense of safe and secure when I was with them because we all have the similar situations. And when I share with them that I was anxiety or I hear voices, they will talking with me and try to distract me from the voices or the anxiety that I have. And that's helped me a lot. And after they talk to me, I already calm down and I don't feel the anxiety and I focus on the what they are talking to me.
Folks, I think we have a disruptions of the internet. Hang tight, and we will have the Maria and Jason's back on as soon as we can. Just some technical issues on our side. So, Jason, can you unmute yourself?
Okay, yeah.
Oh, perfect. Yeah. So we actually lost Maria's laptop, but that's okay. Here she's come. Okay. So okay. So why don't we can you continue? So can you tell the audience now what do you do at Hong Fu? I share a little bit of information about you while you were speaking. So can you tell the audience, like, what do you do now at Hong Fu, and do you enjoy your times there with with your peers?
Oh, sure. And right now, I'm working in Hong Kong Mental Health Association as a peer support worker. And this is a huge success for me. And that's really boosts up my confidence level because since I was diagnosed with schizophrenia and I haven't found a full-time or part-time job for a long time. And this job gives me a lot of hope and it's very important in my recovery journey. And I'm also very happy that I can contribute back to the community, and then I can help other peers with my experience, uh, and then I thought this is a mutual support because I'm not the only person who's supporting the peers, and somehow the peers supporting me too.
Absolutely, yeah. So yeah.
I really apologize because the laptop just go blank, so I have to come to the other room to continue. Sorry about that. And yeah, thank you so much, Jason. And can you also share about how the group process help, like when you were joining the Hong Kong group, the self-help group?
Oh,
Why
yes.
is that program different from the other programs?
I joined the Hong Kong self-help program because it does help me a lot to redevelop my social skills because I have been isolated for quite a long time. I was living in a subsidized housing for about 5 years, but within these 5 years, I don't have any friends to talk to. I don't have my family, parents to talk to. I just talk to my voices, and my life is so disconnected with the reality. But since I joined the Hong Kong self-help program, I can make some friends within the Hong Kong community, and the people is so nice, and we supporting each other, and during the group, I start to work as a volunteer in the food program for the self-help program.
Right.
And that helps me a lot to learn a lot of cooking skill and interpersonal skills. And after that, one of the staff asked me to facilitate a group called the Happy Friday. It's recreational programs. People may be playing cards, mahjong, and board games and chit-chatting, and then it helps me to build up facilitation skills. And after 2 or 3 years, Hong Kong offered me a chance to apply for a peer support role in the Hong Kong Mental Health Association. So I applied for it, and after interview, they hired me as a peer support worker.
Right. Oh, wow. That is a really great recovery journey. And I just want to summarize that because we are in our role, we always committed, we would like to provide the most effective support. So to recap from your sharing, that we can hear the turning point, one of the turning point of your condition is that when you met with your social worker, that she did not give up. That word really dawned on me, did not give up, right? Because you said you ignore her, you refuse to talk to her, but she still comes. And each time she brings something, right? And to introduce some new idea to you, right, Jason?
Yes, I remember that when
Yes.
I was living alone, and somehow I will feel anxiety, and I will drawing or painting something, and my social worker, when she come to visit me and she saw my painting,
Yeah.
she encouraged me to do this and more, and even she asked me to go to a painting class or drawing classes.
Okay.
So
Yeah.
that's a very positive feedback for me. So by the time I keep drawing and keep painting, and that's helped me to cope with my anxiety.
Wow, that's really great. And I also want to reinterpret one thing that, I mean, when we are talking about health practitioner, they are very specialized in their knowledge that the medical part is very important, that as Jason's sharing, that because after he took the medication, it helped him to manage the hallucination or the delusional thinking. But yet, that something that really support him to come out and to join those groups and to have the hope is from the relationship, right, Jason? From the personal relationship that you build, that also your involvement with the peer support group, that you had the peers supporting you, helping you, that you're not alone. I remember when you shared with me that word also really teach me a good lesson. Not feeling alone is very important, right, Jason?
Yes, because before I joined the peer support group, I thought I'm the only person have
Yeah.
these kinds of problem of mental health issues.
Yes.
But after I joined the group, I meet other peers and we share our own experience, and we have so much to similar things, and then I don't feel lonely anymore, and I have the support from other peers.
Right. Oh, that's great. So right now, I would like to invite the floor. If you have any question you would like to ask Jason, please feel free. You can unmute yourself or you can type in the question. But I would suggest that you can unmute yourself and you can just talk. Anyone?
I have a question
Right.
for Jason. Do
Uh-huh.
you still hear those voices, or
Okay,
it is over?
right now, and I think it's been like almost 10 years. I haven't heard any voices anymore.
That's good. Thank you for sharing your experiences.
You're welcome. Thank you.
Yeah. Anyone else? Okay. Okay, so it seems that okay, we all good. Actually, we earlier we prepare a case study, but now this screen go like blank, and we would like to thank everyone for your participation, and we really apologize for the technical problem. But I guess Dina will post this on the website. So if you have any question, please feel free to ask as well. Okay, so thank you so much for everyone's participation. And actually we will have last webinar on the first week of November, a Thursday, on the cultural competency approach. All right, thank you everyone.
Thank you all. And also, we'd like to say that OCASI will be sending out a post-attendance survey to gather your feedback and to help us improve our webinars for the future. So please check your email for that. And we would really appreciate if you took a few moments to just provide us with some of your feedback. And yeah, just take a moment to thank Emily and Maria for hosting this webinar today.
Okay, thank you.
I have a quick question, if that's okay. I'm so
Yeah.
sorry.
Yeah, for sure.
So I'm in the United States and I'm not really familiar with your program. I think they were pronouncing it Hong Fook. Is that correct? I'm not sure.
Yes, it is Hong Fook. It's spelled HONGFOOK, Mental Health Association. So we the first webinars that we have, we did mention a little bit about what we are. So basically, the words in Chinese, I'm not Chinese, but I'm Vietnamese. Similar meanings. It's prosperity, health and prosperity. Hong Fook started about 38 years ago. When have you folks heard of boat people? Boat people? Yes, that's my grandparents.
Yes.
So a group of volunteers who are Hong Kongese, Chinese, and Vietnamese volunteers just started Hong Fook as a volunteer group to narrow the gap of translations, helping with psychological issues with refugees from Vietnam, and then after that was from Cambodia. These group entails of psychiatrists, social workers, and from different healthcare backgrounds. 2 years, less than 2 years after that, it becomes an association because again, they thought it was just that year that people flush in with the refugees, but then the need grow. And now we serve 5 languages, Cantonese, Mandarin, Vietnamese, Koreans, Cambodian. And of course, I work with a lot of second generations of Vietnamese. We speak, our main language was in English, but because of the trends and demographic change, and that's what the word behind Hong Fook. So Hong Fook is health and prosperity. Even up to today, I'm so glad you asked these questions. Even up to today, when people heard about Hong Fook, even though it said health and prosperity, the stigma there was still very, very great out there. Even though both Maria and I been on the road for more than for both more than 15 years to do to demystifying mental illness, but still have high stigmas that stick toward mental health. So as soon as they hear mental, they don't care about the health or illness.
Whatever else comes after.
Right. That's right.
So does your organization, I'm sorry, I didn't mean to cut you off. So does your organization kind of try to promote like mental health awareness and kind of I don't want to say prevent, I guess it could be preventing the stigma, but ultimately you're trying to like promote those who do have those mental illnesses, like healthy ways on how to cope with it, kind of like what Jason's story was talking about, just kind of finding him healthier avenues on how to channel those energies and how to cope with, his mental, illness. Is that kind of, I'm trying to make sure I'm picking up on the right things that your organization is doing.
Absolutely. So with our service, we have psychiatrists, we have nurse, we have social workers, we have promotions workers like Maria and I. We purely just do educationals for the past from the beginning, for the 30 somewhat years, even when we first started to do prevention and promotion, prevents mental illness and promote mental well-being. at the early years, 30 somewhat years ago, it started off with the psychiatrists doing workshops. And their first workshop was, "Are you crazy?"
Oh, Lord.
One person show up. But again, trending up until today, I think the medical model is quite stigma as well, I would say, if I may, on this topic. A lot of people have different thinking, and like you heard about Jason's experience, Jason is not actually is the only one. Even a lot of our consumers and my own my own clients, also 30 something years she's been through the journey, and sometimes when they relapse or they have different thinking or different choice, different information, they will change their mind on different models. So we have the whole team that working with the community that we serve.
Gotcha. So do you have any like occupational therapists or physical therapists, things like that? Y'all do? Okay, awesome. That's great.
I'm so glad you asked, because we attach with our agency, we have the nurse-led practitioners clinics, where the nurse was able to prescribe medications, and we have physiotherapists that work with our clients. We have dietitians that work with us, health promoter. So we it's a whole spectrum that we work with.
Gotcha. Thank you so much for giving me that information.
Thank you so much for joining. Any other questions?
Yes, Emily, I have a question. I want
Yes.
to know if Jason, I don't know if Jason is still or not.
I think you have to speak louder than that.
Better?
Yes, I can hear you now.
Yes. I don't know if Jason is still here or not, but I wanted to know if he's still taking medications or how much he found the medication helpful. And is it something that a combination of things, medication and maybe self-help groups, and did he get formal therapy sessions as well, or the self-help group and peer support were the main things he used?
Jason, are you still there? I don't see him on the screen. I would assuming that he is not on here. I can somehow summarize, because I think when we get to peer support work, is it another set of, I guess, regulations in order for you to able to work as a peer support worker. You will need to will not see, okay, so at Hong Fu, because his worker is at Hong Fu. So in order for him to work at the workplace that he received his therapy, he has to be a discharge for 6 months. He can still see he can still take medications, go get other therapy, get a social worker from other workplace, because here we treat Jason as our co-workers. We have the same level of regard. His feedback toward our feedback are the same. We take them very in the equal standard. So let's say if I'm Jason's worker and I work with him, then that's a little bit of conflicts, and it's harder for him to fully, how would I say, fully participate in his role at Hong Fu. So if you think, is that answer your questions?
Yes, I just want to know like what other support, because he mentioned a social worker and the self-help group and peer support that he received, and also later on he worked as a peer support. I wanted to see for how long he was taking medication. Is he still taking medication? Just wanted to get more information how much the medication was helpful to him, and also if he received a therapy session in addition to self-help group and peer support in order to be in a place that he can provide support to others as a peer.
Yeah, I think Jason is here.
Oh,
Maybe he
Jason,
can,
are you here?
yeah, he is mute, but he can unmute himself and answer.
Jason,
Maybe.
are you here? Well, I think our time is
Okay.
almost done, but I can share with you quickly.
But maybe next session, it doesn't have to be at some point. I think it's important when you work with people.
Right.
So if you're out of time, no problem. Maybe
Yeah.
next session.
I think Jason is, I don't know if he can hear us, but I can tell you that I work, my consumer, my volunteer is actually his work as a peer support workers at Mount Sinai. And she still see me. She still see the psychiatrist that I'm working with. She's, mind you, she's been here 30 something years, just a similar time as maybe a little bit more than Jason here in Canada. She speaks perfect English, and she still wanted to see a psychiatrist that culturally reflects her own background. So the psychiatrists do not, but I still stay with her in the appointment, even though we all speak English, but she needed that support. So she still volunteer with me, see a psychiatrist, take medication, but she works somewhere else. She needs some support in terms of work stress or something that she share. She can still see me. So that's just almost like, I cannot answer for Jason because I'm not Jason's worker. But like I said, I have many consumers that work as a peer support worker somewhere else in the hospital setting, in CAMH, in Mount Sinai, and they still see me. They still see us once in a while. Like I see her maybe once every 6 months. If something during the pandemics nowadays, we message each other more. We talk a little bit more, just to ease off the anxiety so she can help other people in her line of work. Is that?
Yes, thank you.
Okay? Yeah. Well, I'm going to end our sessions now so that Dina can send out the survey. Please bear with us. We're still learning about technology, and we'll try to do better next time. Remember, we don't have the training next week, but we have the training the following weeks. Okay, well, thank you so much, folks. And I will hope to see you all again next week. Oh, the week after.
Yeah, thank you
Thank
so
you.
much.
Bye for now.
Bye to everyone.